Okay.
How to say?
Good morning.
Yeah.
Started morning.
Good morning. I am Adam. I will be your PT for today's aquatic exercises. And this is Aquatics case number 35. Stop ka na eh. Okay, for case number 35, the patient is in need of manual stretching to increase their right shoulder internal rotation and strengthening of their gastrocnemius. Here we go. Okay, so for manual stretching to increase shoulder internal rotation, patient must be placed on the pool supine with manual assistance to keep them afloat, and then their arm should be positioned in 90 degrees abduction with the elbow flex at 90 degrees also. The PT shall stand lateral to the affected extremity facing caudally or downward towards the feet. Okay, so for hand placement, the PT will stabilize the scapula of the patient by using their elbow, and entering from the axilla, they will grasp on the proximal arm of the patient. With their other hand, they will grasp the distal forearm, and then for direction of movement, they will direct the forearm downward or palmarward, and then apply the stretch force. For stop that. Okay, so for parameters, the affected extremity will be held for 3 seconds, and once it's backwards in its position, this action will be repeated 20 times. So basically, parameters of stretching will be 3 by 20. Okay, so for the strengthening of gastrocnemius, patient position is still in supine, but this time the PT's position is standing laterally to the patient's affected extremity, facing cephalad or towards the head.
2, 1.
So for hand placement, assuming that the patient's upper half of the body is already supported, the first hand of the PT should be placed on the posterior aspect of the distal leg, and then the other hand would go on the plantar aspect of the foot. Stop that. For instructions, the patient will need to point their toes downward. By then, you will use the arm that is placed on the plantar aspect of the foot to apply resistance. And then you can also have the patient flex their knee using the hand you placed posteriorly on their distal leg to apply resistance also. For parameters, we shall be doing this exercise for 10 repetitions in 3 sets, and this will be done at least 2 or 3 times in a week. Okay, so give one contraindication for aquatic exercise and briefly explain why it is contraindicated. In this case, one contraindication would be unstable bowel and bladder control. It The hydrostatic pressure from the pool would increase the intra-abdominal pressure of the patient and would force them eventually to involuntarily void or defecate, not only contaminating the water of the pool, but it would also serve to be embarrassing for the patient. Okay, so patient suffers from ulcerative colitis, which is an inflammatory bowel disease that causes inflammation and ulcers in your digestive tract, specifically in your rectum and colon. Due to this, patient has a colostomy bag attached to him. Could you perform aquatic exercises with this patient? So,
Okay.
basically, yes, a patient with a colostomy bag can perform aquatic exercises. These colostomy bags are designed to be waterproof. They will not leak easily with the correct seal, but I think at most it is precautionary. They will merely need to secure their colostomy bags because although they are waterproof and leak resistant, there is also still the risk of it being damaged while immersed in the water. So basically, again, yes, a patient with a colostomy bag can still perform aquatic exercises.
Stop.
Okay, that ends our Aquatics Retdem, case number 35, BCS2 Lab signing out. Take two. Okay. BCS2 Lab. Done.